is like, the other products, they're 90% collagen or whatnot.
Right.
Ours, we're like 45% collagen, and then we have big amounts of elastin, laminin, fibronectin.
Okay.
And so, the reason we went with that is because, each different component has its own set of binding sites, signaling components, and all that,
Right.
Within it. So, the more, diverse mix you have, the more chances that you're going to be giving the body what it needs to do
Right.
what it needs to do.
Right.
So that's really the nuts and bolts of what we do. Is
Okay.
what I've tried to do is, again, I've worked on tissue stuff now for 20 years. I try to, why didn't this work in this application? Why didn't this work in this application? Really what it comes down to is we're trying to get, the diversity of the signaling. Because when we're talking about powder topical applications, the scaffold doesn't matter because the scaffold just gets broken down anyway.
Right, yeah.
So let's first off, let's do part of that process. Let's turn it into a powder,
Right.
so you're not waiting for a sheet to
Right.
break down. But then let's also see how many different components we can get in there, to give the body what it needs.
And so yours are primarily obviously just for like wounds, like of all kinds, or burns, or diabetic wounds, open wounds.
Yeah, so it's
like,
basically everywhere ACell indicated
Right.
for, it's the same thing for us. So
Okay.
venous diabetic pressure ulcers,
Right.
trauma, surgical wounds,
Yeah.
Mohs surgery, disc wounds, tunneled wounds, second degree burns,
Right.
all that sort of stuff.
'cause I use a lot of mine for my trauma patients who like come in and they're just they're just simply missing like a big chunk of everything.
Yeah.
Skin and muscle and fascia and stuff like that. I mean, it's just gone. It's like wherever their injury was, like on the highway or whatever. It's like, so there's like nothing. I mean, what are you gonna do other than you can wait like 6 months of wet dry dressings or try to back in and then it just eventually heals some granulation and scar tissue or eventually skin graft. But the reason I like the ACell was because it was just healing these wounds really, really quickly. How to get to the point where I can skin graft them, or the point where instead of having a graft this big, they need a skin graft that big, or even to the point where it closed.
Right.
I mean, we had patients, had like a thoracotomy incision that was just like open forever, and wound care nurse kept him coming, and he wasn't getting any better. We see him in the clinic, and then one day it's like, screw it, I'm gonna just put ACell on him, and like literally after like it was probably like 2 or 3 months of this open thoracotomy wound. 2 weeks after the ACell, the wound like completely closed. And now he just has that little scar, and that was it. And the wound care nurse came back, and the clinic appointment was like, I don't know what the hell you did to that guy, but like,
Magic.
Yeah,
exactly.
exactly.
I loved work. I worked with ACell.
yeah.
Like I said, and
So
it's
that's why that's like really like why I like that product. But it'd be interesting to see kind of what yours does and how it works and.
No, and that's really how we designed it is basically to do that same thing. Is
Right.
when you've got not necessarily huge volumetric tissue
Right.
loss,
Yeah.
but
No, but we have patients coming also like wounds, like little wounds,
Right.
but they just for months
they can't get it over that
close.
hump, and that's what when really help develop that granulation bed. You can flap it, you can graft it or whatever, or
Right.
like you said, you can let it go and heal it in all the way and see what happens. Whatever facial stuff, sometimes they want to, you don't want to. It's hard to mobilize a flap when
Yeah.
you're dealing with
Yeah.
scalp and stuff like that. So,
No,
Yeah.
that's cool. So you guys, it just powder it comes in.
Yeah, actually, I have one. Do
500
you have one?
milligrams, 1,000 milligrams.
Yeah.
Or
yeah, 250, 500, and 1,000. So it just we put it in a
a
little easier to use jar.
Yeah. All right, and you just put it on. You mix it.
You got a tunneled wound. You want to make a little slurry or paste and smear it on there. You
Okay.
can, but I mean, for the most part, if you've got a hydrated wound, you can just sprinkle it on
Stick it
and
on,
cover it
yeah,
with a
so-
non-adherent dressing, petroleum gauze or whatnot, and just keep it moist.
Sorry, hang on.
No, you're good.
Sorry about this trauma. Hey, what's up? His brain looks negative and C-spine.